What do you think what it is? M or W? What about this? 6 or 9? What if we land in exactly same situation when we are diagnosing a skin disease? What will be the condition when we land like that in such a situation where it becomes very difficult, or one person is saying it's something else, like one is saying it's W, another one is saying it's M, one is saying it's 6, another one is saying it's 9. What if we land in such a situation when we are diagnosing a skin disease? Namaste, welcome back. Hope you have gone through the previous session, right? Previous video you have gone through, I think, and you all are fine and doing well. So, in this video, we are going to see a little bit complicated one, but not that difficult, right? So, in this video, we are going to discuss about one Lakshana and multiple presentations. In last video, if you have not watched, watch it, right? So, Dosha assessment part 1. In that, we discussed how Vata presents clinically, how Pitta presents, Kapha presents, and all, or what and all takes place in that. So, in that, we have discussed, I think, Vataja Lakshanas with some images, some uh, cases we have discussed, right? In that, we have tried to understand how each, like one dosha, particularly we have concentrated, and same thing can be applied to Pitta and Kapha, right? Now, what if in previous Lakshana, what we have studied, like something like, for example, Sankocha is Vataja Lakshana, and if Sankocha is having different presentations, right? If that situation is there, then how to understand this? How to understand this? This is the session. In this video, we are going to see how the first video, Samprapti, and the Dosha assessment both will join together, right? How they are joining and how we have to use them in assessing the clinical presentation, right? Now, for example, take this case. Three cases are there. Lakshana is Srava or Parisrava. Right? Srava or Parisrava, one of the Lakshana seen in Pitta and Kapha also, right? All the three patients show different presentation. It is Srava, but presentation is different, right? Presentation is different. Let me ask you a question. Can we consider this case as a condition due to increased Vata? Can we consider it as a condition due to increased Vata? What do you think about this? Write in the comments. Write in the comments. What do you think? Is it Vata Prakopa? Let us go a little bit deep. Now, when we zoom into the upper part, when we zoom into this, means when you closely observe this part, entire thing is like that, entire lesion is like that. You can see here, there is pus secretion. There is pus secretion. Oozing is there. Sticky oozing. Pus is there. So, is it Vata Prakopa? Now, Vata Jalakshana, what is said? Alpa Srava or no Srava at all. So, is it Vata Prakopa? If it is Vata Prakopa, what type of one? If we want to call it as there is association of Vata, is it systemic Vata Prakopa that led to this or something else? Actually, actually, it is crusting. It is crusting due to environmental air exposure. Due to environmental air exposure, the secretions and the thin wound debris thing got dried. That got dried and it became like crust and it is looking like, right? Toxputana, dry, right? Ruksha, Toxputana, like Vata Jalakshan. So actually, in this, there is no Vata Prakopa. Internally, there is no Vata Prakopa, right? Actually, it happened due to external exposure to the Vata. The lesions got dried, right? So, what is very important to understand when a same Lakshana is presenting in different way is, I told you, we are going to mix the Samprapti and Dosha assessment, right? If you have not watched the Samprapti video, watch it. It's must, it is must. That is why I have put that as first one, right? Now you can see, I have explained in that video that there are three types of pakas. Overall, in skin disease, we can consider the conversion of healthy skin into ugly looking or unhealthy skin or Kushta Roga or skin disease is due to Paka, right? It's because of Paka. Now, I told in that video that as per my understanding, not in that video, overall, there are three types of presentations of Paka. One is where Pitta is Drava because of increased Kapha and Drava Pitta and less Vata. So, oozing and all will be there. When Alpa Pitta and little less Kapha, but very Vata is also there, more Vata. At that time, what happens? The skin becomes oily because of Sasnehata of the Pitta, because of the Dravaguna of the Kapha and Sasnehaguna of Pitta, it becomes like oily appearance because Vata is more. So that is doing Shoshana. That's not allowing this type of presentation. Because here Vata is less, so there is no Shoshana. Drying is not there. Drying effect is not there. So it led to this type of presentation. Whereas in this Vata is also there. More Vata is there. So that dries to some extent. So that is why the lesion becomes, sticky or little bit oily appearance. Right? Here Pitta is less, more Kapha. Pitta is less, more Kapha and more Vata. So what happens? That Kapha which is Drava having Kutumabuta and Jalamabuta, right? So that Jalamabuta getting Shoshita, dried by increased Vata. So that leads to hard, rough, this type of lesions, right? Katina lesions, hard lesions, right? So this is what is happening inside, right? Now we will see actually the three secretion conditions, right? Srava, right? Now what you observe in this? When you look into this patient, the image of this patient, what do you feel about the nature of the secretion or how is the secretion? How is the secretion? It is completely watery and non-sticky, right? It is, you can see water drop like. It is completely watery and non-sticky. What it is? It is Lasika Srava. Lasika is again a Pittaja presentation. So it is Pitta dominant Srava, right? Lakshana is same Srava, but here it is more of Pitta. It is Pitta dominant Srava, right? I think now you understood how to do assessment of Srava, right? Now do little assessment of this. Try to do little bit assessment in this. Now how is the Srava? How is the secretions? How is the secretions? Here what was there? It is non-sticky, non-staining. It's not at all staining. It's completely like watery, right? Lasika. Lasika is non-sticky, right? Lasika. Yeah. Now, in this, it is sticking. You can see it has dried also, right? Srava has come out. It has fallen out, but it has left that stained, dry patches. So, what it is? It is more sticky and comparatively thicker. More sticky and comparatively thicker. So what will be the condition? What will be the dosha? Here it is kapha pitta dominant. Right? In this previous condition, in this more watery, that means lasika, right? More of pitta, no kapha at all. Or maybe very scanty type of, you can consider like traces of kapha may be there. Now in this sticky, right? It is sticky and thicker. So when it becomes thick, like Ushna Jala, consider Lasika as salt water, something like that. Okay, consider like that. So when it will become thicker, when we add Prithvi Mahabhuta into that, that is Kapha. When Kapha association starts with that, it becomes more and more thicker. So more the thicker, it stains more, right? So what is happening here? Staining is there. It is sticky and thick. Right? Thick, staining and sticky. So it is kapha and pitta dominant. Kapha, pitta dominant condition. Now you can make out the difference, right? Here it is non-sticky, non-staining, completely watery. Here it is sticky, staining and thick. Right? Here non-staining, non-sticky because mostly pitta. Here it is staining, sticky because pitta is with little bit kapha. Pitta with less kapha or some amount of kapha is there. Here completely pitta. Here it is associated with little bit kapha. Now what if kapha was more? I forgot to add that image. Now how to understand that? Because now here what you are saying, the color of this stain is almost same as the color of the underneath skin, right? Means still, even though kapha is mixed with that, but it has not become as opaque as it will become when more kapha is added into that, right? So that is why I told less kapha. Kapha is there. Here, almost no kapha. Here, little kapha is added into that, right? That is why it became thick and sticky. But it's not so much kapha that the secretion or the liquid becomes completely opaque. It's not opaque, right? Because we are observing what color we are seeing, the underneath skin, almost same color we are seeing here, right? So it is the difference between these two. Now, what about this? Let me give a zoom in image, right? You can see zoom in, more sticky, less watery, and it is associated with swelling also. So it is kapha dominant. So kapha is not always like kapha means not necessary it is compulsorily watery. No, it is prithvi and jala mahaputta dominant. Right? Prithvi pradhana jala will come with that. So it will be like kichad jaisa, matlab clay like it will be, but not hard one, like little sticky clay. So when more kapha, so it will be more thick and sticky, less oozing. So when pitta starts associating with that, it becomes more and more oozing. When kapha starts disappearing from that, so it will become completely water secretion. Right? Understood? What is happening there? So here more kapha, very less pitta. It is pitta is so much that it is just enough to melt little bit amount of kapha. That's it. Only for that, pitta is involvement is there in this, because otherwise pitta was not there, then it would have not become like this type sticky presentation would not have been occurred if there was no pitta at all, because that kapha should get melted. Ushnata, ushma is needed, and that comes from pitta, right? So because of that, it is kapha dominant, but there is slight pitta because all the kustas, all the skin diseases are said to be tridoshaja, right? Now you understood, right? So hope you have watched up to this. Means you are understanding it and you are liking it, maybe. So if you feel this is work, please click that like button, and if you are new to my channel, please subscribe, and whatever doubts, questions you have, you can type them in the comments, and if you want any specific video on particular topic, you can write that in the comments. I will try to make a video on that, and if you feel this is good one, value adding, and you can share with others. Like it's not over, I will be going into now. We saw Srava or Parisrava. Now we will consider one more Lakshana. Again, different presentations. Mandala, which dosha? Mandala. We have not discussed Srava, we have not discussed Mandala. I have not taken, that is why Vataj Lakshana, because in that previous video we have discussed Vataj Lakshana. So I thought of giving little bit idea about how Kapaj Lakshana and Pitta Lakshana are also present, right? So Mandala means what? Mandala is a circle, right? Mandala is circle. See, actually, the word meaning of mandala, not necessary that it should be circle, but you need to understand mandala is a kafaja lakshana. It means it is well defined, systematic, right? It is well defined, systematic. Like you need to understand. In many of my lectures, I have told that to learn about the skin presentations or nature, how the dosha behaves in skin diseases, we need to understand the behaviors of the individual prakriti persons, like how vata prakriti person behaves, exactly that way the vata dominant skin lesions behave. Vishama visruti, abnormally spreading. So vata prakriti people are not so well organized. So the lesions in skin, if it is not well organized, then you consider it as it is vata dominant, right? So pitta prakriti people are very irritant. Suddenly they get angry, and simultaneously they become cool also. So the lesions, what is the swabhava of the pitta roga? Ashu samuttan. Immediately they manifest, and if we treat them correctly, they subside immediately also, right? What is kapha? Kapha is mandagati, right? Mandagati and mandala. Mandala means they are well structured, well defined. Kapha prakriti people are like that. If you go to a room or somewhere, if you visit house or the place where a Kapha Prakriti person lives in the room, lives in room or something like that, personal room, there you can see the things will be well organized compared to Vata Prakriti and Pitta Prakriti. So that is what is Mandala. Mandala is well organized, right? Now you can see the Mandala. This is fungal infection. This is thigh part. I thought, actually it's thigh, medial aspect of the thigh. I thought, to place it vertical, I rotated it. Okay, this is also tinea infection, right? Cruris, and you can call it as corporis. This is on arm. This is psoriasis, right? Psoriasis. This is also psoriasis. I have taken two presentations, mandala, in same diseases. Like in the dhru or tinea infection, mandala here is having erythematous border, raised borders. Mandala here rough borders, rough margins, still mandala. Means what? This is pitta with kapha. Kapha with pitta you can call. But as pitta redness is more dominant, that's why I'm telling. It is pitta with kapha, right? And this is vata with kapha. Dryness is more, right? Dryness is more, vata with kapha. Now psoriasis, here also mandala, here also mandala. Now what you can say, this is more with vata, vata dominant kapha or vata kapha. Here you can see kapha vata, right? The same mandala presentation in same psoriasis, it is different. So Lakshana also, when we call the Lakshana as like one Lakshana, multiple presentations, right? Lakshana is same, but presentation is different. We'll see one more Lakshana to understand it in better way. Anyonya Sansakta means clustering, clustering. The lesions will be arranged in clusters, right? It is one of the Kaphaja Lakshana. It is one of the Kaphaja Lakshana, right? Now you can see four different presentations. All the four are having Anyonya Sansakta. I've arranged them from more vata to less vata. You can see here the lesions are elevated, thick, clustering. They are arranged in clusters. They are more dry, more rough, more hard. Right? Here also they are arranged in clusters, but compared to this, they are smooth or soft. Mrudu. Here they are more katina, khara, like that. Here they are comparatively mrudu. Comparatively mrudu. Means here more vata dominant kapha. Here you can say kapha dominant vata. Right? Here acne clustering again. Now compared to this, here more kapha is there, less vata with kapha, pitta. Here more vata, kapha. Here more kapha with less vata. Right? Here more kapha with very sorry. Here more kapha with very less vata and little bit pitta. Right? Now here also clustering is there. Anyanya sansakta, more pitta kapha, or we can call more kapha pitta dominant, very less vata. This is also anyanya sansakta. Anyanya sansakta, more vata. Anyanya sansakta, kapha with vata, more kapha, less vata. Anyanya sansakta, more kapha, less pitta, very less vata. Here, anyanya sansakta, very less vata, more kapha and pitta. Understood? So, this is very important when we are planning the treatment. Right? Because in all these four conditions, we cannot go with same line of treatment. We cannot go with same line of treatment. For simple example, like for example, in this we cannot do any washing and all. Seka we cannot give. Right? We cannot give. And we have to go with Tikshna lepa. Like Pashanavat Katina, Acharya Charaka has said, even Tikshna like Visha type of lepas are explained like Arka, Chitraka such. Here we can go with comparatively Argvada and all. That type of we can apply. Here we need to go with just like few days you can go with Trifla wash and then Lodra application. Here more clear we need to go with Panchalukala type of wash. Getting my point? Right? Here we can go with oil. Here also we can go with oil. Here and in these two cases we cannot go with oil. We should start with Seka. Right? We should start with Seka. This preferably is suitable for Trifla, whereas this is more suitable for Panchalukala. So this is why even if we are able to diagnose like yes, I'm diagnosing dosha based on lakshanas, like same lakshana will be having multiple presentations, right? Same lakshana will be having multiple presentations. So we need to understand them in repeatedly. We need to observe them. Now, recently one of my students was asking, if we don't get patients, what about that? No problem. No problem. Internet is there. right? Or you go to your library or you go to any book like Atlas, take that Atlas, look into the image and try to assess the doshas. In that given image, what Lakshana or what presentation depicts which dosha. Go on doing that. Just 15, 20 days, some 100 images, you'll become perfect. But should be like, they should be of different range. Like if all are on pitta dominant presentations or if all are on kapha dominant, no, it's not be like that. Varying presentations. And again, same you can try. Like for example, I was giving example of pitta. You go with only pitta lakshanas, list of pitta lakshanas, go to the any dermatology atlas, then assess pitta lakshana in psoriasis, pitta lakshana in eczema, pitta lakshana in like acne, pitta lakshana in fungal infection, pitta lakshana in scabies, pitta lakshana in scalp psoriasis, like multiple things, right? Pitta lakshana in so many other skin diseases, like vascular disorder, pitta lakshana. Like we have to assess. So same Pitta Lakshana, same Srava will vary from disease to disease. That we need to understand, and then we'll be able to, like for example, I told you Seka is suitable, but which Seka I have to do? Whether I have to go with Tripla Seka or whether I have to use Panchavalkala Seka, that we are going to learn by understanding what exactly is happening in that. Right? That is very important. So that is why I thought to make this second part where we are mixing the Samprapti and Dosha association and using both the knowledge of Samprapti and the knowledge of Dosha Lakshana to come out precisely about what the clinical presentation says. Right? So if you want to improve your clinical practice in Ayurveda dermatology, or if you want to practice Ayurveda dermatology effectively, you can join our course. It's a 50 hours online Ayurveda dermatology course. 30 hours is for psoriasis only. It is psoriasis management mastery in Ayurveda, completely clinical case based. The second one is 20 hours on dermatological manifestations of Visha. We call it as hydrotoxic dermatology, wherein you will learn contact dermatitis, allergic skin diseases, bites and stings induced skin disease, drug induced skin disease, occupational skin disease, so many things where we consider the contact and even internal exposure as Visha. That type of presentations are dealt in that it is 20 hours. The actual cost is more than 10,000. But in our platform, offering price is 7,000, but only for exclusively for the audience who go from YouTube, you will get 700 rupees discount. Means you can join this course at just 6,300 rupees. You will get lifetime access anytime, anywhere, as many times as you want. You can watch the videos, and link is there in the description, and you will get certificate on completion of the course. You will get a certificate, and it will be a physical certificate. We will send it to your address. On completion, we will ask your address, and you have to give that, and we will send that, post that certificate to you. So hope video was useful. For more details, you can contact me. And if you feel the video was worth watching, please like the video. And if you're new to our channel, please subscribe. And whatever you feel about this video, please write them in comments. And if you have any suggestions, please write them. If you want me to make a particular video on particular topic, any topic, you can suggest me. And please share the video with most of your friends whom you feel it will benefit. So thank you for watching, and take care. Read and forget, don't forget to read. See you again in next video. Take care. Namaste.